Hi, guys. How are you all? It's good to see you. Am I in the frame? I guess got to scoot over a little bit. Hi. Happy Friday to everybody. It's great to see everyone here. I'm actually going to lower this a little bit. We have a lot of really big things to talk about in the COVID world, guys. I know you guys have seen the headlines. We're going to jump right in because there literally is so much stuff to talk about. As By the way, I'm Dr. Jen Caudle. I'm a practicing family physician. I'm also an on-air health expert and video creator. I do daily videos on COVID and other health topics. I do lives on Mondays and Fridays. So happy Friday to you guys. Okay, let's just start by talking about the NFL. I want to just start right with that because I think it's actually a really big thing what the NFL is doing. I don't know if you guys heard, but the NFL basically, to be clear, they are not mandating that players get vaccinated. Okay, that I need to be clear about that, which I think is a really important point. But what they are saying is a lot of other things that I think really is a pretty tough and solid stance. They say if a game is canceled because of a COVID outbreak among unvaccinated players or staff, and the game can't be rescheduled, the team with the outbreak will forfeit the game. So they'll take a loss for that. And there could also be, and very likely will be, other penalties, such as financial penalties and things like that. This could involve players' salaries. It could involve the team's overall operating budget in terms of handling, lost expenses that were lost in the forfeiture or cancellation of the game in terms of the other team. Once again, I wanted to loop back and say, however, though, that the NFL is not requiring that teammates and staff get, rather teammates, I should be very specific about that, not requiring that teammates get vaccinated. First of all, welcome. It's great to see all of you, but I would like you to weigh in below about what you think about this. We've heard a lot of commentary from a lot of athletes, former football players. There have been remarks on Twitter from current football players talking about how they feel about this. And some are really not happy with the idea that there could be these sort of stark penalties if there is a COVID outbreak amongst unvaccinated people. I did read the memo from the NFL, and the NFL does cite the COVID data, the CDC data about how effective vaccines are, how much, COVID vaccines keep COVID cases down, how this is a public health issue and everyone has to work to keep people safe. And it does cite that appropriately. And then once again goes on to say, look, there's a COVID outbreak among unvaccinated players or staff, and it can't be rescheduled. The team with the outbreak will forfeit the game. There could also, and very likely, will be other penalties that are financially related. Guys, I actually, and I'll tell you what I think about it. I'm asking you what you think about it. So put it in the comments what you think about the NFL doing this. I think that it's perfectly fine. I think that, these are what the NFL is saying to their players and to their teammates and to the fans is that they value the health and safety of their players, and they value the health and safety of staff and other people who are working with the teams. And as you know, there were a couple, Dr. Myron Roll, who was a former football player. I believe he's a neurosurgery resident at Mass General. He was on CNN today. And he was saying, I believe it was him who was saying this, or maybe it was another football player, but somebody was saying, this is a business. And just like hospitals are sort of putting in mandates in schools as well, saying you must get vaccinated. It's a business. It's about the health and safety of players and staff and other folks. It's about the ability to carry out a season. It's a lot involved with this. So again, just let me know what you think about the NFL doing all of this. We'll see how this all plays out. But once again, the NFL is not requiring that players get vaccinated, but they are saying, hey, look, if you're unvaccinated, you take that risk and you get COVID and there's an outbreak, there are going to be consequences and you'll feel it. So we'll see what that does. And we'll see how this changes things, as things go on. And once again, it's what we're seeing with other employers, right? We're seeing this in other places. We're seeing that people are being let go from their jobs, hospital jobs and others, because they don't want to get vaccinated. We are seeing that people are leaving their jobs because they don't want to get vaccinated or they have refused to get vaccinated. So we're really seeing this play out in real time. Let's jump a little bit right now, guys. And once again, welcome to those of you all who are joining me. I'm Dr. Jen. Thank you for the stars. Also, thank you for all of you who follow my page. I'm on YouTube right now live. Hello, YouTubers. If you've not liked and subscribed to my channel, I invite you to do so. And for Facebook, if you've not liked and followed my page, please do as well. Star senders, God bless you. I will respond to all of those who send stars personally. Also, just a quick note, people, those of you who are getting your COVID vaccines, that is awesome, by the way, guys. Please get your COVID vaccines. I do have a group called I Got the COVID Vaccine. If you want to hear and connect with other people who are getting their vaccines, have questions about the vaccines, just check out the pinned comment that I have. It's in the description for YouTube, and it's a pinned comment on Facebook. Okay, so now let's go a little bit to let's go to Delta and to what's happening in the world and with cases right now. So I'm just going to give you a few stats that we have, that we know what's happening right now. We know that the majority of people who are entering hospitals with COVID infection are unvaccinated people. We know that. We also know that the majority of people who are dying from COVID are also unvaccinated. We also know, however, guys, and this is pretty sad and makes me very sad, is that today in particular has been the lowest day for vaccinations really since January, since we started vaccinating people. So we're literally going in the wrong direction. Cases are going up and vaccinations are going down. That is not what we want. But I do want to reassure us in some ways. I did a video yesterday. I don't know if you guys took a look at it, but some of the 5 states that have the highest, the highest rising rates in for COVID cases and the lowest vaccination rates are also some of the states with the highest number of new people getting, the highest, sorry, I want to say this right. These are some of the states with the highest rates of people getting new vaccines. Okay, does that make sense? So in other words, in these states where there are a lot of COVID cases and not many people who are vaccinated, these are also the states where people are running out to get the vaccine at higher rates than the national average. That is wonderful. And that makes me encouraged. If you have not seen that video, I invite you to take a look at it. It was posted yesterday. It's those 5 states. Take a look and see if your state is on the list. But that does make me encouraged. But there's still a lot of problems, and I'm going to give you some of those numbers, guys. Okay. We know that Florida is leading the nation in new COVID cases. For those of you who are in Florida, just let me know what's happening on the ground, how you're feeling, what's going on, like literally on a day-to-day basis. Also, we know in terms of kids 12 and older can get the COVID vaccine. Back to school is right around the corner, and we need kids to be vaccinated, those who can be, because we know that there are kids under 12 that cannot be vaccinated. You know, remember, that's one of the benefits and one of the reasons why we all, the rest of us, need to be vaccinated who can be, right? Is because there are many people who cannot be, including kids under the age of 12, people with certain medical conditions, certain allergies, etc., who can't get the vaccine. We have to protect them. Okay. But when it comes to kids, there are only 27% of kids aged 12 through 15 in this country are fully vaccinated. That's a problem. That's not very many at all. That's less than 30% of kids 12 to 15, age 12 to 15 are fully vaccinated. And not only that, kids 16 to 17, only 39% are fully vaccinated. It's a little bit more than the 27%, but it's certainly not enough. And for you parents that are sending your kids back to school in the fall, one of the things that's going to help you and I and everyone else feel a lot better about your child being back in school is having your child vaccinated. It's going to protect teachers. It's going to protect your child and other children as well. I also want to mention, again, these are just a number of stats that I've been sort of taking notes on all throughout the day because there's a lot of pieces of information coming in. You guys know that, for a while, there was a bit of a lull with COVID. We weren't sort of in this frenzy that we're in now. This is how it felt a year ago. Every day there was something new. Every day there was a new worry, a new concern. We're a little bit back there because COVID cases are increasing. So there's a lot of movement. We know that Alabama is the least vaccinated state in terms of people who are fully vaccinated. In Alabama, there's only 33.9% of people who are fully vaccinated. People in Alabama, please get your vaccine. People in Florida, please get your vaccine. People basically everywhere, if you haven't gotten it, please get it. Okay. And what we're seeing as a result of this is we're seeing, when people are not vaccinated, we're seeing an increase in COVID cases throughout the country. Why? Because number one, people are not vaccinated, but also because of Delta variant. We know that Delta variant is responsible for at least 83% of COVID cases that we're seeing. And in some places, it's responsible for more than 80%, 83% of the cases. Delta variant, we know, is more highly transmissible, and it's literally running rampant. Guys, it is everywhere. And it's scary in terms of how quickly and how easily it can spread. And that's what it's doing. The best protection we have against Delta is our vaccine. And not only that, by the way, this is something I wanted to say, is that, if you're sort of setting aside Delta saying, oh, it's not a big deal, let's not forget that we could easily, after Delta, have another strain that's even more highly transmissible or more dangerous or deadly. Delta, the fact that it's here doesn't remove the possibility that other strains and variants could come. The problem that happens, amongst other problems, people getting sick, people dying, et cetera, the problem that happens when people are not vaccinated and when COVID is spreading throughout the community is that leaves room for more variants to form. One of the things that stops variants from forming and from developing is we stop transmission. We stop the spread, and we do that by getting vaccinated to protect ourselves. And we do that by, getting vaccinated and then following the other measures that we have, right? If you are unvaccinated, wearing your mask, social distancing, all that kind of stuff. The fact that there are these pockets of places where people are unvaccinated and there are these areas where cases are going up just means these environments are ripe for further cases, further spread, and honestly, anywhere that this is happening, future variants. We could have a more highly transmissible variant than Delta. Delta is just the variant of the day, of the month, of the week, and we hope that we don't have any others, but the way to stop that is getting vaccinated. And if you're not vaccinated or fully vaccinated yet, wearing your mask and doing all of that. So I did want to say that, COVID cases are up 65% over just last week. That's huge. We have over 40,000 cases for the first time, 40,000 cases per day for the first time since May. This is really where the caseload per day is now kind of higher than what it was during the first surge that we had. And the cases that we're having now daily are 4 times higher than we had even a month ago. I was raising the warning sign about COVID and Delta. We all were a month ago when I was on vacation with my family and all of that stuff. Who would have thunk that a month later we'd be where we are, which is that things are even worse than they were a month ago. So I'm saying all of this to say that this is really important. And with vaccines being at the lowest point that they have been since we started vaccinating is really scary and really one of the problems, one of the big problems here. Guys, I want to welcome you if you're just joining. I'm rattling off statistics. There's a lot to tell you. I've been kind of waiting all day to chat with you guys about what's happening in the news and sort of a summary from the NFL to Delta variant to we're going to get into face masks. We talked a little bit about COVID cases. Thank you guys for joining me. I go live every Monday and Friday. I also have my group, I Got the COVID Vaccine. If you have questions about the vaccine, you want to hear from other people who are getting vaccinated, please check out the pinned comment on Facebook. Also, you can sign up for my free health newsletter as well. Make sure you put your email address in to sign up for my free health newsletter that comes out once a week. And that's on Facebook and YouTube. You can check the description of this video and you'll find all the links there. So just want to keep you guys updated and informed to make sure that you have resources. So what is all of this meaning? That we now have increased COVID cases, that things are really increasing the way that we are, that Delta variant is, we're having hospitals being overrun again. We're having healthcare workers. I'm talking to healthcare workers on Facebook and on social media, and they're saying, oh my gosh, here we go again. It's just like it was before. We're kind of getting back to that place. What does this mean? It means that things are rolling back. Mask mandates are being put back in place. You guys know I live in Philadelphia, and Philadelphia just yesterday made a strong recommendation to Philadelphians that they start wearing masks when they go into indoors in places, and that we strongly stay outside in social distance and do all of that stuff. That is a strong recommendation that was just made. Hold on, I gotta sneeze. Sorry, I don't know where that came from. Anyway, so that's happening in Philadelphia, but we know what's happening in Los Angeles, right? Mask mandates are being put in place. Schools are now requiring that kids wear masks when going back to school. And if you think about it, I don't want to say it's a punishment, but we're rolling back. We're going backwards. for all of you who don't want to wear masks and don't want lockdowns and don't like the idea of COVID, not getting vaccinated and not adhering to COVID precautions if you're not vaccinated is what's actually allowing you to have to deal with COVID even longer. It's a bit paradoxical because I know there's many of you out there that are concerned about the vaccine. There are some people who think that COVID doesn't exist. There are other people who think that the push about the COVID vaccine is sort of a part of a larger plan by the government or by some other entity that's trying to make us do certain things. There are some people out there who believe that I've seen memes or people say, aren't you going to die in 3 years if you get the COVID vaccine? And I'm like, what? Oh my gosh. There are many that are worried about long-term side effects. I just did a video on that recently about, the fact that we are not concerned about long-term side effects and the reasons why. There are some people who are saying, well, why should I bother getting a COVID vaccine when you can get breakthrough infections? And I did a video on that as well, saying that nothing is 100%, neither are COVID vaccines. Remember, when you get the flu shot, you can still get the flu. We've known that. But the idea is that if you get the COVID vaccine and you were to get COVID, it's less likely that you will become severely ill or even moderately ill, and you're much less likely to end up in the hospital and to die, which is what we care about, right? You're also less likely to transmit it to others and things like that. So there are many, many reasons why many people are concerned or cautious. Tuskegee syphilis experiment and historically relevant and very real racial injustice when it comes to healthcare systems. That's very, very real, and I acknowledge every single day. But the thing about it, guys, is that while the racial injustice and the historical injustice, for example, is a very real thing, these vaccines have been tried and tested on people of all cultures, races, etc. The standards for the vaccine, we have been included in terms of people of color. We have been included in the testing. These are safe vaccines. These are effective vaccines. These vaccines are actually some of the things that will help the racial injustice dynamic that exists in terms of healthcare disparities. It will help level the playing field. African Americans, we know, are historically, and other people of color, Hispanics, we are disadvantaged when it comes to COVID. We know that we get sicker, we die more, we have worse consequences. And one of the things that will turn the tide for things like Tuskegee, won't change it, won't reverse it, won't make us forget it, nor should we. But one of the things that will change the tide is getting vaccinated so that we don't continue to remain at a disadvantage the way we were disadvantaged and really discriminated against in Tuskegee and in other healthcare environments throughout the years. This vaccine is one piece to a puzzle of leveling the playing field in terms of racial health injustices and racial health disparities. But on the other side, things like saying the COVID vaccine will cause infertility, it will change your DNA, there's vaccine shedding, all these things, those are just simply myths. Those things are just simply not true. So the level of problems that we have exist on many different levels, from the truth, Tuskegee, and the reality of racial disparities, to untruths, such as, the vaccine will cause you to, grow 3 heads and, lose 2 limbs. That's untrue. But what I want to say, though, is that for those of you who are against the vaccine, please remember that feeling and that behavior continues to perpetuate your need to be confronted with this virus on a daily basis. For those that are not getting vaccinated, it's actually not helping the situation. It's not removing you any further from the COVID vaccine, the need for it, or COVID. The likelihood is that if you were unvaccinated and you have not had COVID, chances are you are probably likely going to get it. And the problem with that is we don't know what will happen if you should get it. We don't know if you'll be hospitalized, if you won't be. We don't know if you'll end up on a ventilator, if you won't be. We don't know if you'll spread it to other people, if you won't. That's the problem with COVID, is remember that a lot of healthy people with no underlying health conditions can end up with COVID and do poorly. We don't entirely understand. So I guess the question is, it's not the only question, but it's one of the questions, is that a risk worth taking? And I know some people say it is a risk worth taking, but as a family doctor and somebody who cares about everyone, it's not a risk worth taking. And Yvette, you said it's not the chips, it's the nanotechnology. No, it's not nanotechnology, and that's a myth too. Nanotechnology around this vaccine, that's a myth too. So what I would say is that, we're having to wear masks because COVID cases are increasing because we have pockets of unvaccinated people. But what it's doing is that the mask wearing is not for the vaccinated. Those of us who are vaccinated, the science still, at least the CDC is still standing behind the science that those who are vaccinated are still largely protected from COVID and don't need to wear masks. The mask mandates are going back in place for those who are unvaccinated. Because number one, there are people who are unvaccinated that are out and about that are not wearing masks and putting themselves and other people at risk. And on the off chance that if someone who is vaccinated gets COVID and is relatively asymptomatic, which by the way is most commonly what happens if somebody vaccinated gets COVID, but then it could spreads it to somebody who's unvaccinated who's not wearing a mask, which would perpetuate spread. So this is, I heard a reporter today on the news say, "Oh, so is this punishment? Is this, and punishment probably is not the right word, because there's rhetoric going around on social media now about like victim, or is it with shaming and blaming and all of this kind of stuff. But I mean, the truth is, like, we have to call a spade a spade. You can call it shaming or blaming or this or that. I mean, pick your word, whatever. I don't know, but it's facts. We know this pandemic is being perpetuated and fueled at this point by those who are unvaccinated. What else do I want to talk about? And by the way, thanks again for the stars, you guys. You guys are amazing. I love you all. Thank you guys on YouTube for the super chats and super stickers. If you're not liked and follow my page, by the way, on Facebook, please do. And for those of you on YouTube, if you're not subscribed to my channel, please do. So, this is kind of where we are, guys, with COVID. We've got the Olympics that are happening right now. We've got more people who have had to sit out from the Olympics. It just breaks my heart. Every time I hear of another athlete that has to sit out in the Olympics because they've tested positive for COVID, breaks my heart. Can you imagine working your entire life for the opportunity of a lifetime and then having to sit out? And for those that I've heard that have gotten COVID, and I've only heard of, we know that there's, 61 cases, maybe more. I haven't kept up with those numbers, but the ones that I've heard about have been vaccinated people. Can you imagine that? Can you imagine the devastation? And again, it's not to blame those who are unvaccinated, because that's too overreaching. But the idea is, the more that all of us are vaccinated, and the more and the less COVID that there is everywhere, the less risk that everyone has. The less COVID there is in the world, the less of a chance that there is that an Olympic athlete who's been working for this all their lives will have to sit out a game because they got COVID, even though they got vaccinated. So the idea is that it affects us all. Let's see here. One of you are asking a question. Deborah, I just got over having COVID. My doctor said you should wait till October, 3 months after having it. You no longer, and again, I'm not your doctor, so you should make sure you discuss this with your doctor, but the CDC no longer requires a 3-month wait after having COVID to getting the COVID vaccine, so long as you've met the quarantine requirements, you have recovered, etc. Okay. Now, there are some people who have to wait 3 months depending on what treatments you've received, if you received monoclonal antibodies or things like that. So once again, I can't give you advice, but I do want to let you know that not everybody has to wait 3 months. Okay. So guys, this is my request for you and for all of us. Let's keep waving the banner of getting the vaccine. And for those of you who are not sure, it's okay to not be sure, and it's okay to have questions. That's what I'm here for. That's what your doctors are here for. That's what, hopefully other people who are health professionals are here for. Ask questions. Ask questions of your doctor. Ask them if it's true, the rumors that you're hearing. And look, if you're reading stuff that's scaring you, whether it's nanotechnology or other things, before you blindly believe a social media post, you should probably run that by your doctor, don't you think? I mean, think about it this way. It's a pretty big thing to believe and to base your health decisions on without getting a verified answer. So, if you don't want to believe me, you don't have to. But before you base your entire health, potentially, or the health of your family or the people around you, on something you heard someone pass along on social media, and you can't verify it, before you base something as important as your health on that, please talk to someone you trust, aka a doctor or a healthcare professional, and get their opinion on it. I would recommend doing that before you blindly decide that all of these things are correct, nanotechnology and whatever else is going on. Okay. So that's what I'm asking all of us to do. I want you all to get vaccinated, and I don't want you to wait if you don't have to. If you got monoclonal antibodies and blah, 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 yeah, there are reasons why you might have to. And there are reasons why some doctors are saying to their patients, no, it's not a good idea for you to get the vaccine. Follow your doctor's advice. I'm not your doctor, I'm not your personal doctor, right? But please get vaccinated. For those of you who have gotten the vaccine, put your favorite emoji in the comments. You know, this is my favorite part of my lives when I'm like, put your favorite emoji in the comments. Thumbs up, smiley face, heart, whatever you like. Go ahead and put your emoji. Sasha, thank you for the stars, honey bun. I appreciate you being here. You said you're late, but you were here. You are here. I went live a little bit earlier than I normally do. And make sure that you guys join my groups. A Healthy Living with Dr. Jen is a group where we talk about all sorts of health topics. It's in the pinned comment, also in the description on YouTube. I got the COVID vaccine. Make sure you join that group as well. Put your email address in so you can get my health newsletter. YouTubers, you can do that as well. Also, I got the COVID vaccine t-shirts. These, I donated a portion of the proceeds to the Red Cross. I wear these just to show my faith in the vaccine and to encourage others to get it. And it's my way of showing pride. So if you're interested in these, they're on my website at drjencaudle.com/shop. Also on the pinned comment on Facebook and in the description on YouTube. I love all of the emojis that are coming in because you guys are getting your vaccines and you've gotten them. And I love that. And you guys are amazing. The thing that's going to get us. Oh, and let me say one last thing before we head out is I am so happy to see a lot of the politicians and TV commentators on different parts of the aisle speaking up for vaccines. It's about time. Had to happen. Needs to happen. So, please listen to that. And for all of those political commentators, TV people, please keep that up. Governors, red states, blue states, yellow states, green states, please keep it up because we're all in this together and we need everyone to get vaccinated for us to do well. Guys, as always, I love you. That's why I do these. That's why I'm here. I'm Dr. Jen. There'll be more videos tonight and tomorrow. I go live every Monday and Friday. Make sure that you don't miss a live, that you join me. I love you guys. Stay safe and healthy. Talk to you soon. Bye, YouTube. Love y'all.